All right, welcome back to the You Can't Fool You podcast, where old school values have a modern edge. And before we start this episode, I want to give a huge shout out to our sponsor, the Vertigo Center, helping you find balance when the world won't stop spinning. So if you or a loved one are suffering with balance, dizziness, or vertigo, please contact thevertigocenter.com today to take your first steps towards steady living. So we have Emily Roper on as our guest today. Emily, thank you for being here.
Thanks for having me.
Yeah, so I'm excited for our conversation today. What is it that you do?
Well, I do a couple of things. I own a private therapy practice for kids, so I'm a neurodevelopmental delay therapist. So I look at early physical development and how that impacts brain function later on. So emotions, social skills, academics, all of that, kind of looking at it through this early physical development lens. And then also, I work as a midwife's assistant. So I help deliver babies and provide postpartum care for families. And they're both like very different in their practice, but they're very connected. So a lot of the things that we're working on to, help moms with during pregnancy and labor and postpartum are really to prevent a lot of the problems that I see in the kids later on that I'm working with. So.
Gotcha. And what are some of the things that happen that cause the problems?
Well, there's a lot of things that like can go wrong during pregnancy, during birth, that early postpartum period, all of like that's a really critical period for development for kids because so much is happening with the brain and the body. It's just, they're going from basically being this single cell to being a full blown human over the course of 9 months. It's a
Yeah,
lot that's happening.
it's pretty wild.
So there's lots of different things that can happen prenatally, that can happen with the birth process, that just affect development. And a lot of times the types of people that are caring for moms and babies during that stage are also not the same people that take care of kids later on with development issues. So we just have a slightly different lens when you're kind of looking at development through this more holistic lens of looking at it from conception all the way into childhood. Um, so it's kind of how those two pieces ended up getting connected for me.
Okay. And what is it about that? Like, why did you choose to do this? Like, what is it? Is it from either your own experience or you're just naturally like super interested in it and saw a gap that you like wanted to help fix?
No, I just totally fell into this actually. I
Yeah.
so I started off interested in the therapy and the development work because my cousin had a lot of issues. So he's a couple years younger than me, and he had like every different diagnosis under the sun. His mom had tried all sorts of both traditional and non-traditional therapies. He'd been on lots of medications. And nothing really seemed to help. He was just behind emotionally, had a lot of like major emotional struggles, really was not functional in school at all, struggled with academics in a big way. And anyway, she finally found a therapist that did this type of like early development work. And he started making massive changes. Like all of a sudden, his emotions started settling down. He was a very anxious child, would not do much at all. Like, couldn't get on an escalator without having a panic attack, wouldn't like climb on the playground. And all of a sudden, he's doing all these things. And he's like communicating with the waitresses at the restaurant and like not having a meltdown when it was time to leave places. So I got to see that when I was a teenager and got really excited and interested because I knew how hard it is when you have a kid that struggles that much to try to find some support. It's just hard on the whole family. So he started getting a lot better. So I was really interested in that. And then when I was a teenager, I had a lot of anxiety issues myself. I developed an obsessive compulsive disorder called trichotillomania. It's like a hair pulling disorder. Like literally, you're so stressed you pull your hair out. That's where the that like
Yeah. Yeah.
phrase comes from. And so I started seeing his therapist too, and started getting way better. So I got to witness not just him, but then I got to go through that as a teenager and was just really like impressed and helpful. It was incredible for me. So when I was
What
in
were some of the
college,
things that you had to do though? Like, what were some of like the practices that you were doing that were like actually making the change effective?
like the therapy,
Yeah, like what do you do? Like what do you do to fix that?
Yeah, so it's actually a physical type therapy. Probably the closest thing that most people would know about would be something like occupational therapy. So
Okay.
for me, the biggest problem that I had was I had a really hyperactive and hypersensitive stress response. So I had well, let me back up a little bit. So babies, when they're born, they have a startle reflex called the moro, which is very sensitive. It's why newborns are really sensitive to like any little changes in the environment. And it's what helps them start breathing after birth. So they're exposed to gravity for the first time, they're exposed to light and noises, and they startle really easily. They gasp and take a deep breath, and it helps them to kind of make that transition. So it's really, really important for new babies to have this like hypersensitive startle reflex, but it should mature into a much less sensitive, much more dynamic reflex or startle response that incorporates a lot of other reflexes that help us to kind of evaluate the situation. So, for example, older kids, if you like drop something and it makes a loud noise, they'll jump and then they'll orient towards whatever that is. And then their brain makes a lot of like quick processes to evaluate what's going on. And then we just settle back down and don't actually go into a full stress response if we don't need to. So it's a much more dynamic process. But for me and for a lot of the kids that I work with, that never developed right. So, like, I kept that really early infant version of that startle reflex. And I had to do a lot of like physical therapy type work to actually like get my body to develop a more appropriate startle reflex. And that's one of the things. There's lots of other pieces that kind of go into it that affect, how you how you process sensory information, how you interact with the environment, that type of thing. So that was like the major one. But once that started working better and I stopped startling so easily, then I had a chance to like, my nervous system and my brain just had a chance to kind of like start responding better and to start maturing properly. And the for me, that anxiety disorder was a result of having this like super sensitive nervous system, and once that was gone, the anxiety disorder went away. It was, anxiety is kind of a symptom of something else. There can be a lot of reasons why that's there. For me, it had to do with these like actual physical reflexes.
So a couple things. Anxiety. What's the difference between like some like I feel like as humans it's normal to kind of just be anxious
Mhm.
sometimes. Like just like sometimes it's normal to just be like a little depressed. Like it's a normal human reaction. But then what's the difference between like I guess you're like the anxiety you are experiencing definitely very different than someone who's just a little anxious because maybe they're just overly stressed out because of schoolwork or career or life or something. Like what makes those different?
Sure, that's a good question. So obviously there's a spectrum between like anxiety, feeling nervous about something is a very normal and healthy response depending on the environment that you're in. But there's a spectrum in which that becomes really disruptive to your daily function. And depending on how severe it is, it can develop into like a lot of different diagnosable categories. So, you can have somebody who is just like really generally anxious about everything. It doesn't have like a specific cause, and it's very disruptive to their daily life. And then it can also develop into things like obsessive compulsive behaviors, like hair pulling, like all of these other more clinically significant things. And I, the like giving diagnoses is not my area of expertise. You would want to talk to somebody who like really does that every day to give you more nuanced answers to what that looks like. But in general, it's just a much more severe version of kind of normal anxiety or normal depression about specific things that we all experience.
Yeah, I can see it. I so yeah, I can see the difference there. So like they're on the same spectrum, it's just the severity. It's
Yeah.
just the severity of it. Now, could is it possible that say, hey, somebody starts out as like if the higher end of the spectrum's down here, lower, like can it get worse over time? Or Is the ones that are more severe, is it kind of like something, there's like a chemical imbalance, or like you're maybe it's born with it? Are these things like genetic?
Yeah, I mean, all of those things, genetics influence it, and then our environment influences it. So it's definitely something that can get worse. I mean, you see, like, it's very normal for things like anxiety to get worse for kids around the time they go through puberty because we have these big hormonal shifts. And so that also can increase anxiety, especially for girls. But also things like traumatic life events and like being in unstable situations, going through something like a separation or a divorce, or even something like a wedding or having a new baby, like big life changes can kind of affect our level of anxiety. And again, I'm not the right one to tell you exactly when that dips over into something being clinically significant versus just maybe more of a normal day-to-day anxiety stuff.
I think that comes from like like the big, so like big life changes. There's, I guess because they're big life changes, there's a, you could say, a large degree of uncertainty that's attached to that, which causes the anxiety.
It can be, and some people are just naturally more anxious than other people. Some people are just not very prone to anxious type thinking, where other people
Mm-hmm.
are. Women in general tend to be like more, fall more into the anxious category of things. So there's certainly personality differences. There's things like our attachment styles. I don't know if that's something
Yeah,
you're familiar with.
a
um,
little bit, yeah.
yeah, that's something that's becoming like a lot, people are starting to know a lot more about it. And some people, depending on, what their early childhood was like and what their relationship with their parents and early caregivers is like, tend to be naturally a lot more anxious. And it can even contribute to a lot of significant mental health problems later on. And it's really like, it's less about the problems that are happening in the present moment and more about how their brains and bodies learn to respond to things. And some people have kind of like a learned anxious response to the world, and that's the way that they interact with the world.
Yeah. Now, sort of tying it back to the pregnancy,
Mhm.
can, so if a woman is pregnant, how can that impact the baby's, like when the child's born? If like say she's in a an environment that like is, say, not so good,
Mhm.
does that transfer like over, like all of those things
Mhm.
transfer over into like what the child gets? Or that's like a
Absolutely.
horrible way to describe it, but like does that impact the child basically?
Yes. Yeah, it completely does. So let me like kind of explain a little bit about how the brain works so that this will be really clear. So
Yeah.
the brain develops through experience. So it basically is like learning how to function. So how we move our bodies, how we interact with the world, what we experience, those things directly shape how our brains and our bodies function. And in pregnancy, that's very dependent on what mom is experiencing. So one of the whole points of pregnancy is basically that it's teaching baby's body how to function based on what mom is doing. So, for example, like
Interesting.
mom's blood sugar goes up and down, and baby's blood sugar is going to go up and down. So, that's one of the reasons why we want moms to be like really healthy and have stable blood sugar and eat nutritious foods, is not just because they're growing a baby, but because they're teaching their baby's body how to like react to food and blood sugar and those types of things. And that's even more true with our nervous system and our stress response. So basically, mom's stress levels go up and down, and babies are going to mirror that in smaller doses. And essentially, the idea is that if mom is like functional and stable and healthy in her environment, then it's teaching baby how to be functional and stable and healthy in that same environment because that's the world that they're going to be
Without like
coming into.
the baby even knowing.
Yeah, exactly. These are
It's
all
almost
like
it's almost like
subconscious.
it's almost like marinating the baby.
Yeah, exactly. Exactly. You're marinating the baby. And that's why we have so much research looking at stress in pregnancy. And we know that moms that have like high chronic stress levels when their babies are born, they're a lot more reactive and sensitive to stress. And that seems to kind of be a baseline that they keep for their, like, that's their baseline. Not that that can't change. Our stress levels and our nervous systems are very adaptive. We can kind of learn how to change those things at
Yeah.
lots of different points. But it kind of is like setting a baseline for kids is what they experience while moms are pregnant. And the problem is that most people hear that and think like, okay, we need to just be really calm and we need to not do anything in pregnancy and we need to just have really low stress. But the reality is we don't want no stress. We just want good levels of stress like you get when you exercise, and we want good recovery so that babies are learning to experience stress and then to recover from it. So that's why things like encouraging moms to exercise in pregnancy can be really helpful for their baby's development because they're learning how to function based on what mom is doing.
Yeah. And so I'm a strength and conditioning coach, but I'm not super well educated on um exercising during pregnancy,
Hmm.
like what limits there are, you know what I mean? And so like when I think this is a great question, is what how stressful, and I mean stress like exercise stress, should your exercise be when you're pregnant? Because like I've seen people that they look very pregnant and they're still working out pretty hard, you
Yeah.
know.
Yeah.
Yeah, so
Well,
what does that look like?
sure. So first of all, like this is not specific advice to any individual. This is like
Disclaimer.
yes, exactly. I am not your care provider, so um but uh there's a couple of things to consider with pregnancy that is different when you're not pregnant. The first is that you have a lot of hormones that make like your joints and your ligaments softer and looser. So you're more prone to injury
Yeah.
when you're pregnant. So you have to be really careful about using good form, about certain dynamic movements that could
Yeah,
make you
yeah,
more
yeah.
injury prone. So that's one of the things you have to consider. The second is that especially the further along you get, the more your center of gravity changes and so your balance can be off. So again, like
Okay.
really intense dynamic movements are more likely to result in injury and things like that. You also have significantly more blood volume. You're using up a lot of your nutrients they're going to growing a baby. So you just like your metabolic output is already a ton. And so you want to just like be really careful that you're not overdoing it and that you're really like recovering well as far as like you're eating a lot, you're getting lots of fluids, you're getting lots of electrolytes. And then in reality, it's really individual. So if you're a mom that has done CrossFit your whole life, you can usually keep that up for a while. There might be things that you have to adjust, but working out hard during pregnancy is not a bad thing if you're okay and you're recovering well. You just might have to adjust your baseline and your expectations, especially if
Well,
you're like an intense athlete.
probably I could see this happening. Is like, say, it's one thing if traditionally, right, your training history, like that's been who you are, like you have
Mhm.
trained consistently and you do have a, whereas, and then you can still hit it hard, but
Mhm.
that's because like exercise is like compound interest, right? You've kind of earned the right for that.
Mhm.
Whereas like I could see that somebody who maybe gets pregnant, they're like, oh, I need to start exercising because I'm pregnant and can get healthy. And then they try to hit it hard. It's like, that's probably not good if you haven't traditionally been an exerciser. You probably don't want to go and try and exercise super hard all the time because that's probably not going to end well.
Exactly. Yeah, you don't try CrossFit for the first time when you're pregnant. Like this is
Yeah.
it's really dependent on what your fitness level is before, but you can start. It's not like, "Oh shoot, I've never
Yeah.
exercised.
Don't.
I
Yeah.
can't
Yeah. Yeah.
do it now." You just start gentle. And I'm sure too, with your clients, I'm sure you have clients that have exercised forever and others that are like just starting and
Yeah.
the
The
program they
process,
get is
totally
completely
different.
different.
Totally different. Yeah. Absolutely. And then the next part, which I think it more interesting, I guess, for to what I'm curious about is, what does it look like after you have the baby? Like, what happens after you, like, how does your body change? How long do you have to wait till you can exercise again? And like, I mean, having a baby is a real serious endeavor, like it's
It
it's
is.
serious. And so like, how do you recover from that? Like, how do you get back I guess you hear like get back to like being me again, or
Hmm.
get back into like my exercise routine or getting my body back and stuff like that. Like how do you do that? Or what's going on in there?
Yeah, well, there's a lot that happens. So, um, there's some like really significant changes that happen in pregnancy. You make about 50% more blood. You are growing a baby. You have an entire shift in the way that your hormones work. And you go through labor and birth. And for some women, that's like pretty straightforward and gentle. For others, it's rough and there's a lot to recover from. You have a certain amount of blood loss. And so, for some moms, it's not that much. For other moms, it's a lot and they're anemic and, they're also breastfeeding a baby and they're sleep deprived. So recovery is going to look very different depending on, who you are, how healthy you were going in, what your fitness level was going into pregnancy, and then how hard it was. So ideally, when you're pregnant, you're exercising regularly, you're eating a lot of nutritious, like whole food, have a whole food diet that's high in protein, high in fats, um, that you have like a decent labor, that your labs and everything look good afterwards. If you're anemic or things like that, then you're going to have to address that first before we're going to jump into really intense hard exercise. So ideally, our recommendation is after baby's born that you take a period of time, like 2 to 4 weeks, to really focus on rest. That doesn't mean no movement. We still want you up and walking around and doing gentle
Like
things.
be active.
Well, we want you to like get up and move. We don't want you to be bedridden. But
No,
like 5 minutes, 10 minutes, get up, walk
something. Yeah.
around, you know, get your circulation going, and then really the focus is rest. And ideally, if you can really rest for the first 2 to 4 weeks and do minimal work, really focus on like if you're breastfeeding, just breastfeeding your baby, sleeping as much as you can. Really think of this as like an intense recovery period where you're getting lots of calories, like, and I don't mean like lots of McDonald's calories. I mean like nutritious, like nutrient dense foods. You're resting and sleeping as much as you can. You will recover a lot better, and then when you start to add in things like exercise, you're not like utterly depleted, that we're like
Mm-hmm.
working from
Yeah. Right.
this place of recovery.
Right.
So
So it sounds like one thing is like the more it's like in training, right? The better in shape you are, the injuries happen,
mhm,
and so the better in shape you are, the more quickly you can actually say you do get an injury, the more quickly you're able to recover
mhm,
from that, as opposed to somebody who isn't that well in shape. It's going to be much harder for them
yeah,
to recover. It
yeah,
sounds like this is like a similar analogy. Like, hey, if you're in good shape, you exercise really well during your pregnancy, your nutrition's good, like mental environment, space, all that stuff's good. That will carry over into you being able to recover faster after
mhm,
pregnancy.
mhm. And the thing to just keep in mind is that like pregnancy and labor and birth is just this massive metabolic output. You're just burning a lot. And so, especially if you're burning a lot and you don't have a good appetite and you're not taking a lot in, or you're breastfeeding and you're not eating enough, and you're sleep deprived and you're not getting enough nutrients in, it's really hard to recover. And I think
Yeah,
that
yeah.
that's something, especially in this society, we don't eat enough. We eat a lot of crap and we don't eat enough good stuff. We don't supplement well. And so, if you can give yourself all of the tools and building blocks, you will be able to do more. It's when we're like really nutrient depleted, when we're nursing, we're sleep deprived, we're trying to recover from blood loss and from being malnourished in pregnancy, then it's a much harder road. So really,
Yeah.
the more you can support yourself, the quicker and better you'll be able to get back, if your goal is to get back to exercising. But
Yeah.
it takes like a solid 2 years for moms to fully like really recover from a lot of the changes from pregnancy. So it's a long
So
time.
yeah, so like 2 years, and now I'll say, you know, you have a baby, and what if you have another one within 18 months, right?
Yeah. Yeah,
then
we do.
then then how that's I mean, right? Like you're not, I guess, not totally recovered and you're back at it again. Does that like set you back further from recovery, or is it still, would you still say like
Again,
it's 2 years after the point, or
it's
it's very
really
variable?
individual. A lot of the 2 years has more to do with like the psychological aspects of having a new baby
That
and
was going to be
the
my next question, is
yeah,
what's going on here
yeah.
after the fact, like you say, hormones, and I'm sure there's just so much happening, like,
Hmm.
and then like your attachment to the baby, there's like a different sort of connection there that's different from you know the dad, and
Hmm.
like what's going on like mentally and emotionally there after you have a baby.
Yeah, it's a huge shift. So, mostly for moms, but for dads too. It's just like this massive psychological transition where now all of a sudden you're taking care of this new baby, and
Keep it
moms go
alive.
through, yeah, a lot of mental changes prenatally. We talk about this a lot, like this pregnancy brain, where there's kind of like this anecdotal thing where moms like
Mom
lose
brain.
intelligence, exactly,
Uh-huh.
and they're sleep
Yeah.
deprived and all of that. But the actual research on it shows that intelligence actually just shifts, and they become a lot more hyper focused and tuned into babies, and they are a lot more
Hmm.
aware of things that their babies need and that they would need to keep them safe and alive and all of this stuff. So it's actually more of just this like intellectual shift that happens. And that
Okay.
piece stays around for at least the first year or so, where babies are just super helpless. Like they can't do much for themselves. And so moms really get kind of hyper tuned in, and that's very normal. It's very natural. It also can be difficult for moms who are used to being more independent or that are more like athletic and used to kind of like doing their own thing. If they're like really career oriented, it can be kind of a big shift to all of a sudden I feel like your brain's hijacked by this little person. It
Yeah.
can be hard for relationships too.
Yeah,
Um,
that's
you know,
that's the next one I was going to ask about.
yeah, it can be really tough for moms and dads if they're not aware of this going in. That like your wife's going to change a little bit, and that's okay.
Yeah.
Doesn't mean
Well,
she's gone.
absolutely. So like right now in my men's group, uh June June's theme is fatherhood. As
Mm,
we were talking about fatherhood this month. And I was watching this video. Um it was, do you know who Chris Bumstead is?
no.
He's like, I think he was like Mr. Olympian, I think. He's a bodybuilder. He might be from the UK. And I guess he was having a conversation with Jordan Peterson.
Mm,
Um and what Jordan Peterson said was, it was interesting. He was like, you have to realize that you're gonna like you're gonna lose your wife for like 6 months, and your only job is to make sure that she's okay.
mhm. Mhm.
And so like there is gonna be this like sort of separation where like you're not getting any attention. Sorry, like you're gonna lose her for this amount of time, and because the baby needs her
Mhm.
in that period of time. And so because the baby's number one need is
Mhm.
the mom's there for the baby, and your job is to then be there for her, whatever that is. But you're gonna lose her. Like you're not getting any attention from your wife, you know. And that was the advice that he gave us. Like that's so interesting, because then like the other thing I've heard, I don't know if it was from Jordan Peterson or maybe I heard it somewhere else, is that like the emotional connection to the baby for fathers doesn't happen until, I don't know the timeline, but it's not there right away. And so you're kind of like, you know not as connected to
Mhm.
the child, and it takes a little bit longer.
Yeah. Yeah, so all of those things are super true and important. And what Jordan Peterson is talking about with that first 6 months is the attachment development that I kind of mentioned earlier. But basically, the relationship that we have with our primary caregiver, typically mom, shapes the way that we view relationships and like the world basically for the rest of our lives. And if what you want to build in that first 6 months is what we call a secure attachment, where basically babies learn that the world is safe and that people are reliable. And from that kind of place of safety, they can grow and learn and explore and thrive. And that is really built from having typically a mom that is very responsive, that they're hurt or they're upset, and mom comes and comforts them and feeds them and takes care of them, because they can't do that on their own. Babies can only like show signs of distress, and they can escalate and escalate and escalate until their needs get met, or eventually if that doesn't happen then they can shut down. And then basically they kind of go into this more survival mode, and they tend to have very negative views of relationships and the world, and it really shapes the way that we interact with people forever. It is one
Mm,
of the like foundations and major risk factors for a lot of mental health problems later on. So even things like PTSD, we have a lot of interesting research that's coming out on like basically our attachment styles and our early relationships either protect us or put us at risk for developing things like PTSD later.
mm,
And so we're starting to look at those types of things more through this attachment lens. So what Jordan Peterson is talking about with like, you're going to lose your wife for 6 months, it's because her role is to like give this baby what they need
yeah.
for 6 months, and it will set them up for the rest of their life. And really, like I know a lot of dads hear that and kind of like might even panic and feel like 6 months is a long time. Like, I don't, this sounds miserable, but it doesn't actually have to be. It can be a very connecting time.
Yeah.
And what I will say is that if you take care of moms during this time when they are very vulnerable, you will set them up to have a really great relationship with you for the rest of your life. Like, it is so important to
Yeah.
moms to be well cared for during that time, and it can make or break relationships. There's a lot of people who end up like that is the catalyst for what ruins their relationship later on, is it creates this significant emotional empathetic disruption. It's really hard to get over. They feel abandoned and lost. Or the opposite can be true, where you take care of your wife for that first 6 months and you just like really set her up to like love you and have a great relationship with you forever. And when like when moms are well taken care of, their babies are well taken care of, your relationship will end up being better and stronger because of it. So don't think of it like, oh, this is just going to
Yeah.
be hard for a while. It can be really, really good.
Yeah. Yeah. And I think being just having the information and being educated around it too. Like now you kind of
Mhm.
know going in sort of what to expect. That doesn't necessarily mean handling it's going to be easy. It's probably not going to
Yeah.
be easy, but at least you're aware of like, hey, this is probably what's to come, and then you can better
Yeah.
sort of either strategize, plan for it, or just be more aware of like what's actually going on in
And to not take
during
it
that time.
personally or feel like it's going to
Yeah,
be this way forever, where you can
yeah,
like really understand your wife and what she's going through, and like realize that this is a good, positive, wonderful thing, and like turn it into something that's a lot better. But it's hard if you don't know that going in, and then all of a sudden you're in the thick of it. It can be a lot.
yeah. Now, so we talked a little like this is what's going on with moms. Now, obviously, mom has the baby, and so there's just like a lot more going on. But is there something that happens on the father side, like when the child is born? Like, is there something that changes within him? Because I've heard stuff like that too. It was like, when I had a kid, like dude, it was just crazy, man. Like something changed. Like, is there anything going on, like with the dads too?
Yeah. Yeah, they go through big shifts too. And I'm not a men's health expert, so I'm probably not the best person to talk to about dad's experience, but I do know that they have like some pretty significant hormonal changes that happen. They actually tend to have lower testosterone, which I know
Mm.
sounds bad, but it's not actually necessarily a
I've heard
bad
this
thing.
I've heard this too. Yeah, 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 yeah.
It helps them to actually connect and attach to their babies better too. It can be a time, like again, that's really like bonding and connecting. It can help men like really get more in tune with the more like emotional side of them, um, which it can be very difficult for some men.
Mm-hmm.
For others, it's like a lot more natural. But they go through a lot of changes too. They're also, going through the psychological changes of sleep deprivation and having,
Mm.
a partner that is more tuned into the baby and all of the different life changes that kind of happen. And for some dads, that happens and it's like easy and great and wonderful, and for others, it's kind of a rough time. It's a hard period. It takes some transition.
Yeah.
Um,
So let's move on a little bit to now as the baby gets older. What's going on? Like, so both my sisters have kids. We're actually probably gonna go try it. So my sister lives like across the street, and he's probably a month and a half maybe
mhm.
old. So he's a baby, like a baby. And so we're gonna probably gonna go see him after this actually.
Fun.
Um, and then my other sister has a 3.5 year old,
Hmm.
and the 3.5 year old age, you know, it's a lot going on there.
Yes.
They are they're fun. They're definitely
Hmm.
fun. Well, they're fun when you're an uncle, right?
Hmm.
I'm not the parent, so but I have fun with them all the time. Um, what's going on there? What as far as the this is so interesting to me. As far as the kids concerned, like the
Hmm.
kids go, some of the stuff that I've read, it's like, okay, this is where they're starting to get a grasp of things. They realizing that maybe a little bit like, hey, I'm an actual like person. I have something in this world. I'm gonna challenge authority here. Like I'm gonna press my limits to see, like what hey, what is it like what can I get away with here before somebody, you know, comes, or if I do is somebody gonna come save me, or like
Hmm.
what is going what is going on there? Like what's going on in the kid's mind? Like what are they trying to figure out?
Sure. Yeah. So the first few years, there's like major development changes that are happening. So we want during that first like 6 to 9 months or so to be like really hyper responsive to babies. So we want to meet their needs really quickly, really often. We don't want them to like suffer for like very long periods of time.
So it's like
As
6 to 9 months in the first 6 to 9 months.
Yes, so that's when
Okay.
and moms tend to be biologically like more equipped and designed to do this. We tend to be a lot more responsive to babies. We tend to like
Yeah.
really be kind of hyper tuned into them. But then as they age, we should slowly start to kind of back off those things a little bit. And as they become more capable of taking care of themselves, then we want to naturally kind of ease up a little bit and let them start to develop some independence and do things. Um, so, like, I think I heard Jordan Peterson one time say, like, you want to start being a little bit neglectful at some point in time,
Yeah, yeah, yeah,
Like, you
yeah.
just ease off a little bit. And that is the time period where dads tend to like really start to shine and be better at fostering independence. That can be really hard for moms. We're really
Hmm.
like more
Yeah.
wired for that infant stage. And dads seem to have a much better job, like, well, let's just let the kid try it, or let's let it, like, it's just, they'll just get a little hurt. It's okay. And, like, tend to have a little bit more tolerance for their kids being more frustrated with things or trying new things and all of that. So there's kind of a nice role that both parents play. And some moms are the opposite, and some dads are the
Hmm.
opposite. It's not always so black and white. But the goal is to start fostering some independence and letting them begin to start meeting their needs on their own, while still at the same time we want to still continue fostering like good connections. And the things that make toddlerhood so intense and like such a big age is that a big part of what they're learning is the very like foundations of regulating their emotions. So
Mm.
toddlers have like fairly well developed emotional brains in that they can experience really big intense emotions, but they don't have like the well developed cognitive part of their brain that's more of like the adult parent that helps you to think more rationally about the situation or to plan. So really, like, toddlers are fun because everything is fun and exciting, but also everything is just really intense and terrible, and they have like
Hmm.
big meltdowns over things. Everything is just big. Um, and so one of the kind of goals that we're working on with fostering relationships during that toddler phase is to like help them learn to process and regulate those emotions.
Mm.
And the goal for that is not to, like, when I say regulate emotions, I don't mean that we are always calm. So a lot of times people will take like being regulated with being calm, and
Okay,
that's
yeah,
not
it's good.
always true.
Okay.
Regulated means that you can experience that emotion, whatever it is. You can let it stay as long as it needs to stay, but it's not driving the bus. So you can still stay connected to the rational part of your brain that helps you to make decisions. Toddlers don't have that. They don't have that rational piece. So what your job as a dad is to like be that rational piece for them. And the goal is to like let them feel all of those feelings and let them sit through that and then help them to slowly develop the tools to you like handle those better. So I was thinking of like for an example that might make this more clear, my son, when he was a toddler, went to peel a banana and like he was throwing the peel away and the banana broke and fell in the trash and he just lost it. Like
Yeah.
absolutely crying, dry heaving, went fetal on the floor, lost it over this damn banana. Like it was ridiculous. And the goal, like the parenting goal in that moment, which can be really hard when you're like you have this screaming kid and it's over a stupid banana. But the goal is to try to stay calm, to like label that for him. So I was like, oh man, your banana broke, and that was clearly not what you wanted to do, so that he can start to see like, oh, they they understand. Like somebody around me understands what's happening. And then I just kind of let him be for a little bit until he started to calm down. And then we add in, then I was like, why don't we try a new banana or we can have a peach or
Yeah,
something
yeah,
else
yeah.
type
I've
thing.
heard that. Give them something that's like, or distract them with something else because they're not like
Well,
banana.
it's giving him
Or,
like it's bringing in the rational piece of like, okay, the
yeah,
banana's broken, but it's not the end of the world because his
yeah.
little
Here's a
brain is
peach.
telling him it's the end of the world. Like the
Right,
banana broke, we're in danger, life is ending. It's just
right.
like all of the, like survival parts of his brain are going off over a banana, and he doesn't
Yeah,
have the developed part of his brain to look at that situation and see it's not a big
right,
deal. So
right.
that's, as parents, that's what we do. We have to stay calm and like offer them solutions. But in relation
Stay
to it,
calm, parents. Stay calm.
yes, in relation to a like kind of this is about building attachments and, learning emotion regulation is they're learning how to do those things. So if you approach them and you see that they're crying and you get really pissed that they're crying and you get really
Yeah,
upset, what they learn to do is like, oh no, like I cannot be upset. When I'm upset, dad is pissed and it doesn't work. And then they learn to shut that emotion down. And so that's not the same. They might learn to look calm, but that's not the same as being regulated. So what they do, they can't sit with that big feeling until it goes away and then
that's a
access
good distinct. It's a great
rationality.
distinction
They just
because
learn
like,
to
yeah,
basically disassociate from that feeling.
interesting, very interesting. Yeah, and so okay, that's a great example about the banana. Let me give you another one. This is too similar to the banana. I guess you know how like when kids are they're yeah, this is too similar, but like one when the kids are you know you're at like the party and then the kids are having a
Mhm.
good time and they don't want to leave and so they're like they either run to the other room or they start crying. I guess that's similar to the banana. Like everything's something's changing.
Mhm.
What about say they do something that's wrong
Mhm.
or like say they hit the dog, like they smack the dog, and it's like you tell them no, and then like 2 seconds later they smack the dog again, or they pull the
Mhm.
dog's tail, or they're not listening, and it's like now you're getting pissed because you're is not listening, right? And then maybe like you put him in timeout, and then they
Mhm.
start crying. Like what is going on there from the kid's perspective? Obviously not registering like, hey, that's not good, don't do that. But like what are
Mhm.
they trying to is that where they're trying to like test how far I can get away with and what's your job? Like what's the proper way to do that? Not like yank the kid away and yell at them and then put
Mhm.
him in timeout. Like, I can imagine, that's probably not that effective.
Mhm.
Um, maybe in some cases it is, but long term probably not. Like what's going on in those types of situations?
Yeah, well, I think kind of the general framework that I would use for any type of situation where you're interacting with a kid like this is that you want to really consider that all emotions are acceptable. We don't want to demonize any emotions. Anger is an appropriate emotion depending on the situation. Sadness, happiness, all emotions are valid. That does not mean that all behaviors are valid. So like you can have a limit
Right,
on,
right.
you cannot hit the dog. Like it's okay to be upset, you can't hit the dog. And so for a child like that, if they're angry and hitting the dog, I would try to look at the situation and just see like, why are they doing that? What's going on? Was the dog in their space? Were they mad about something? What is it? And so what you want to do, what you want to start with is something that we would call mirroring, where you basically show the child that you see what they're feeling and you see where they're at. Because if it's hard
What
to
would that look
accept.
like? What would that look like?
So it could just be as simple, if they're old enough, as like saying that they're upset. Like, oh, I see you're pretty upset about that. Um, if they're babies, it's just matching their facial expressions. It's anything that
Okay.
you do to show somebody else that you understand what they're feeling emotionally. This is great for your spouse too. Like, and
Yeah.
if you're upset about something and your spouse comes to me and they're like, "Oh man, I really get it." The
Yeah.
second that you feel like seen and somebody else understands, it de-escalates big emotions
Yeah.
automatically by itself. So that's the first step, is to like try to mirror them, because we don't you're not going to trust or listen to anybody that you don't believe actually sees and understands where you're at.
Yeah.
If they're upset because they stubbed their toe and you think that they're upset because, you know, you took away a toy before or something, if you like misinterpret why they're upset, you're only going to make things worse. They need to know that you see them in their current state. So I'd say something
Yeah.
like, "Ooh, you're really upset." And then you put a limit pretty quickly on behavior, like, we can't hit the dog. And if they can't stop themselves, depending on their age, if they're 2 and they're just like, go to do it again, then you're like, "Oh, I'm going to move you. We're not going to do that. I'm going to put you someplace safe." So, like, we got to keep the dog safe. You're not allowed to hit the dog. Whatever it is, however you want to intervene in that situation to really like put a hard limit on whatever behavior it is. And then you want to address the situation based on what's going on. So if they're upset about something, then you let them, like, you sit with them and try to stay calm until they've calmed down. And then you offer like different solutions. Like, okay, well, we can't hit the dog, but if you need to, then you can go sit in your room and take some breaths and calm down. Or like, you can go hit the punching bag, or we do like mean fists and then let them go, and like try to
Mm-hmm.
bring it back to the
Yeah.
body to try to get things calm. Just offer them something else so that they know how to do it. It's really easy when you're a parent to start taking things personally, like, my kid's not listening, they're being defiant, they're being disrespectful. It like stirs this up in you get triggered, you're upset, you're pissed, you're not regulated and calm. I mean, I get it, I know all these things, it still happens to me on the regular, especially with toddlers. They really know how to push your buttons in some big ways. But the goal is to teach them how to calm down and regulate their body and how to behave appropriately. It's not about punishing them for doing something wrong. It's about teaching them how to do the right thing. So that's kind of a general framework that you would use in lots of different situations. And it really varies depending on their age, how old they are. 2-year-olds don't have a lot of reasoning skills. So you put more hard limits on things and you do less talking, and it's okay. Like, they don't always get a full explanation why. Sometimes they just aren't allowed to hit the dog and you
Yeah.
move them
Right.
away,
Right.
you
Like,
know?
don't try to teach too much. It's like they're not going
Yes.
to listen to you anyway.
Yes. Teach some, like, little bits at a time. And as they get, older and better able to do things, and also if like, okay, they have a hard time, they hit the dog a lot, then outside of moments where they're doing that, you can practice other things to do. Like, you can practice having gentle hands, or you can practice doing other things when you're upset, when they're not actively upset in the moment. So most of like the teaching and parenting skills that are easier to develop with kids happen not in the heat of the moment. If you can try to
Mm-hmm.
do that when you're in the heat of the moment, it's just hard to, they're not in a good learning state anyway.
Yeah, and I feel like for like toddlers too, it's like a lot of the stuff where maybe you do react and say like stop, no, you can't do that.
Hmm.
It comes from them, and like not in actually like a bad intent way from the kid. They're just like
Hmm.
playing.
Hmm. Hmm.
right? And they don't realize that like hitting the dog is bad. They're just
Mhm.
running around petting the dog because it's
Mhm.
it's fun. It's
Mhm.
fun, and
Mhm.
they think that either pulling the thing or smacking the dog, knocking the thing over. Like I think for them it's more, at least just like from me like watching kids, is like they're kind of just playing and they think it's play, but obviously like it's not acceptable behavior, but they think it's like
Mhm.
just play.
Yeah, and honestly, that's a lot of it. A lot of times I think what ends up happening is we as parents end up getting kind of triggered by their behaviors of things and we take it personally and like we get really upset when in
I
reality
can
they're
see
just
this has
learning.
happened to you. I can
It
see this has
has.
happened to you.
Oh, yes. Oh, yes. It's been quite the learning experience. I have a 4-year-old, almost 5-year-old now, and so we're just getting out of the toddler stage, and it was not my favorite, man. It's a lot.
Yeah. Yeah,
Um,
yeah.
but like most of the time, they just need like a little redirection and a little, and it's not like this bad behavior or this like that there's anything wrong with these kids or that they just need a little bit of guidance. They need to learn what is and isn't appropriate, and they need opportunities to explore, and they need
Yeah, they need
opportunities
the
to
rough and
move.
tumble play a little bit and
They
some of
do.
that. Like,
They do.
and so like yeah, the rough and tumble play like might get a little physical. And like
Hmm.
especially with, I mean, even just like with my nephew, like you pick him up, you give him a little elbow, he not falls down, and you run, you throw him back, and like
Hmm.
you know, and then he's like laughing so hard, and he loves it, and it's so funny, it's so
Hmm.
funny, and then I guess some of that then translates over to like trying to do more of it in a situation maybe it's not acceptable,
Hmm.
right? Because but where it's like he's just trying to play, like you shouldn't like, get that, so it's not inherently bad, it's just like something that needs to be expressed.
Yeah, kids in general need a lot of intense physical play, especially boys. They need a lot of that input. And so, a lot of times, if you're seeing aggressive behavior in littler kids, a lot of times what they need is an appropriate way to get that out because physically their body is craving that type of rough play. And that's really good for development. It's really good for things like impulse control. It's really good for
Mm-hmm.
learning to read other people's like social cues. It's really good for like getting to like learning our own limits of like what's
Yeah.
fun and when does that cross that line. There's a lot of good research on rough play and how important it is for a lot of development. So if you have a kiddo that tends to be like a little bit more aggressive, maybe they just need to like be out running around more. They need somebody that will
Yeah.
really play rough with them. And then you can more easily set the limits on like, okay, we don't do that with the dog, but come here, I'll do it with you. I'll throw you in the air. I'll
Yeah.
run around with you. But it requires a lot of active participation on our
Yeah.
part.
Yeah, you gotta be in shape. You gotta be in shape to do that,
Exactly.
But I mean, I also think like I do think that well, you hear that from. I mean, I work with a lot of adults and or older adults, and I mean, a huge driver to be physically active is to be able to play
Hmm.
with their grandkids. So the things you said, like the rough and tumble play, the throwing them up in the air, the swinging them around, and like getting some of that, like that is a huge driver for a ton of older adults to get back into shape and to instead of being the grandfather that just like lays on the ground and the kid, it's like
Hmm.
people don't want to be that anymore. People don't want to be that type of grandparent anymore.
No.
You see that it's like because yeah, yeah, it takes a lot to run around and throw the kids around.
It
Like this,
does,
it's a
and kids need it. They need parents and grandparents and people around them that will play. Like our kids are really these days deprived of a lot of play. We put them in preschool early. We're doing a lot of book work early. They're sitting down a lot. They need to be up, moving around a lot more. They really need that physical input. It not just for regulation then, but it sets you up to have like a healthy physical body for the rest of your life. Like we should be active. All of us should be a lot more active and playing a lot more.
yeah, yeah. We could all do better and be more active and make sure that translates into our lives and our kids' lives and the people around us. Is there anything that we didn't? cover today that you feel like you want to talk about? I feel like we covered a good range
Yeah,
of
I don't know. We
very
talked about a
very
lot.
interesting, but very with good range of like very interesting topics of conversation. I think it's all that stuff is like super interesting.
Yeah, hopefully this will be helpful for some of the people going into fatherhood and for your dad's groups to get like just a slightly different perspective, maybe.
Yeah, yeah. So, is there anything you think we didn't cover, or is there anything you want to speak on?
I don't know. I think we're good.
Yeah,
You asked a lot of great questions.
thank you. Where where can people go to stay up to date with what you're doing or follow you?
Sure. Probably the best place would be Instagram or Facebook, both at Early Roots. And then I have a lot, like if you have a child that you're concerned about and are looking for some sort of like development help, um, I have most of that information on my website, which is earlyrootsTherapy.com.
Okay.
But then my Instagram and Facebook have just lots of general information too.
Okay. I'll make sure to link all of that in the show notes so that way when people listen to this they can go check you out, follow you, and continue to support what you're doing.
Awesome. Thank you so much.
Yeah, you're great. This is awesome. All right, Emily. Thanks.
Thanks.